Good afternoon, students.
Good afternoon.
We are here to discuss about a patient condition on CSF Rhinorrhoea. This is an interesting case. So you will be seeing very minimal patients with CSF Rhinorrhoea. This is commonly happen. This will happen during road traffic accident. But here the patient came with CSF Rhinorrhoea. The patient was taken care by Saranya. Let us hear from Saranya how the patient presented to the hospital and what is the diagnosis about, and we will discuss in detail. Let us hear from Saranya. Yes, Saranya, you can proceed with.
I am Saranya A from second year BSc Nursing. As a part of my adult health nursing, I was posted in the ENT ward. Here I saw a patient, Mr. Kumaran, got admitted in the Coimbatore Medical College Hospital with the chief complaints of watery discharge from the nose, severe headache, dizziness for past 1 month. He undergone the doctor. The doctor advised to take some investigation like CT scan, MRI scan. After the investigation, the doctor diagnosed as the case of CSF Rhinorrhoea, and he is now under treatment and receiving medications like injection meropenem, injection paracetamol, injection tramadol. Mr. Kumaran had no significant past medical history, and there is no significant present and past surgical history. The physical examination main impressions are presence of severe headache. The pain scale score is 8 by 10. Nasal discharge from the right nostril. Presence of dizziness, redness present, halo sinus present. He receiving medications like injection meropenem, injection paracetamol, and injection tramadol. Let's see the disease condition. Swati, can you read the definition?
CSF Rhinorrhoea. CSF Rhinorrhoea is the leakage of CSF fluid from the subarachnoid space into the nasal cavity due to defect in the skull base and durometer, resulting in watery nasal discharge.
So now you are able to find out what is CSF Rhinorrhoea. Okay. So what will be the next condition, Saranya? How we can go with
The causes of CSF Rhinorrhoea.
The causes are head injury, post-surgical cases, increased intracranial pressure, and meningitis.
Okay. So head injury, post-surgical
cases, increased intracranial pressure, and meningitis.
Signs and symptoms.
What are you going to read? Signs and symptoms.
The signs and symptoms are related nasal discharge, headache, hallucination, loss of smell, hearing loss, neck pain, dizziness, nausea, and vomiting.
You are able to understand what is halo sign? Saranya, can you tell what is halo sign? What is it seen visibly, or it is being done with a investigation?
Investigation.
Okay, so how it is done? Anyone?
Around the RBC, CSF is covered.
Around the RBC, the CSF is covered. So we will be taking a CSF sample, or what? How we are going to see the halo sign? CSF analysis. Yes or no? We will be taking up the CSF. The patient complaint was leaking or clear fluid from the nose. Leaking clear fluid from the nose. So when that is happening, we will be taking the fluid for analysis. So CSF analysis will tell you whether there is any halo sign. Halo sign is, as already told, which will be a fluid fill the space around the RBC. That is called halo sign.
The nursing diagnoses are acute pain related to tissue irritation and inflammation due to CSF leakage. As evidenced by pain scale score, the score is 8 by 10. Imbalanced nutritional status less than normal intake, as evidenced by weight loss. Activity intolerance, sleep pattern disturbance due to tissue irritation and inflammation. Knowledge deficit.
Okay. So what are the things you can do? What are the management for? We can ask a question like, what is the nursing management for pain? Reduction in pain.
Assess the pain scale.
Okay.
Assess the pain scale score. Provide comfort.
Anybody else?
Provide analgesics.
Provide analgesics. Okay.
Comfort devices.
Comfort devices.
Head elevated in 30 degree.
Head elevated in 30 degree for pain relief. You are telling. Already the patient is having sinus of leak. Any measures that will reduce pain. Explain the procedure to the patient. Get their concern whether the patient is free from pain. If you want to move the patient or you want to change the bed, you find out whether these actions are taking much of pain stimuli. Okay, then freeze up. Any other pain reduction measures you can go? Hard compress. Diversional therapies. You can tell diversional therapies. Very good. Any other points? That's all for pain management. Okay.
Nurse's responsibility. Strict antiseptic precautions during nasal care. Bed rest with head elevated 30 degree. Avoid coughing, sneezing, nose blowing. Avoid insertion of NG tube. Provide prophylactic antibiotics. Provide analgesics for headache. Keep the nasal area clean and dry.
Okay. So there are 7 points to be remembered. Yes, everybody heard, no? Sasnya, you can ask any 2 points to be taken from the group.
Stevenson, can you give any 2 points? Any 2 points?
CSF Rhinorrhoea is it is the leakage of fluid in the nose, and we have to give pain management like diversion therapy and providing analgesics.
Can you
Elevate the head up to 30 degree and provide the analgesics according to prophylactic and antibiotics according to.
Okay, good. Good, Saranya. Now we have seen about CSF Rhinorrhoea, the case what Saranya has seen in the clinical setup. Okay, so whenever you see any patient with CSF Rhinorrhoea, find out whether there is a clear watery discharge from either from the ear or nose. If it is in the nose, it is rhinorrhea. If it is from the ear, it is called as CSF Rhinorrhoea. Very good. Good job, Saranya. Remember the patient details forever. Okay. Thank you.
Thank you, ma'am.